We do have a shortage of primary care providers, particularly a shortage of those who are willing to accept Medicaid, Medicare, and certainly self-pay or uninsured. And in fact, I'm embarrassed to say that there's a waiting list of 10,000 people to get into primary care at Denver Health and Hospitals. As chair of the Senate Committee on Health and Human Services, I recently went to visit Grand Junction in the San Luis Valley, and particularly in the San Luis Valley, they are experiencing a shortage not only of primary care but of specialists, where literally somebody has to drive 2 hours to see a specialist. And so I always like to remind people that having health insurance is not the same as having access to health care. Somehow in the United States, access to health care has become something that's, I want to say, almost a privilege. And if you can afford it, you can get it. And you'll frequently hear people say, oh, we have the best healthcare system. And what I'll often reply is, we do if you have good insurance and connections. I am sure that if something happened to my husband, I could get him the best healthcare in the nation, but that's because of my connections and my knowledge of the medical system. I think what people don't realize is that, first of all, we have a 4-tiered healthcare system. We have people who have private insurance who have significantly less difficulty accessing care, although often their co-payments can still be barriers for them. We have people on Medicare who are more and more often finding physicians' offices that won't accept Medicare and Medicare reimbursement. People on Medicaid who have a lot of issues with access, particularly to specialty care, but even to primary care in many areas of our state. And then the uninsured, for whom, at least in the metro area, we have some good safety nets, but there are waiting lists. And so I think that, again, even though we are the richest country in the world, we don't guarantee access to health care to our population. And the other thing I'd like the legislators to know is that people will still get these diseases, and it will still affect their ability to live and their ability to be contributing, productive members of Colorado. How do we help people access health care early on? And thankfully, most people will only need to be screened once every year or two and won't need more than that, other than some guidance on nutrition and healthy living. But then those who have chronic disease, how do we make it easy for them to manage their diseases so that they continue to work and can be active contributors to our society?